What you have to do is you have to use an active, proactive approach like the programs to clean your body up. So yes, it is good to be lean body and to lose fat, but then you have to go into a sauna. You have to take niacin. The Biosphere 2 study showed that if you lose weight, you will gradually move the toxic chemicals out from the fat to the blood, and then you can remove it. Mobilization of the toxic chemicals, and then having a way to eliminate it and to excrete it out. But to mobilize things quickly, you have to use this kind of system.
Are you struggling with chronic health problems? Could it be possible that you would benefit from a detoxification program? If so, how would you start it? Hi, this is Dr. Mercola helping you take control of your health, and today we have Dr. George Yu joining us to help us answer that question. He graduated from Tufts Medical School and did his surgical training at Harvard and Johns Hopkins, and for the last 35 years has been associated with George Washington University and is now in some very exciting trials to help detoxify people from the Gulf War syndrome, I believe, and also 9/11. So welcome, and thank you for joining us today, Dr. Yu.
Thank you, Joe.
So I'm wondering if you could help provide a frame for what information you're going to share, because it seems somewhat unusual for a surgeon, a really conventionally trained surgeon like yourself, to really start exploring these areas of natural health and detoxification. So I'm wondering if you could expand on that.
So around 2002, as a urological oncologist doing lots of surgery for advanced diseases, I was asked to audit some of the cases in which an organization used caloric restriction to approach terminal cancer diseases. And one of the things that we noticed when we looked at the radiographs with Peter Choyke at the NIH was that when the tumor regressed, also the fat, the visceral fat, also regressed at the same time. Now what happened was, because I was so interested in fat, along with the tumor regression, this fellow named David Root, who was involved with detoxification for the 9/11 firefighters, called me, and we became, we had a dialogue in which he said, well, what happens when we remove some of the toxic chemical from the fat? How much is left in the visceral fat, since some of the firefighters were heavy? And I said, probably quite a bit still. They feel much better, but it's a mobilization of the fat. So that's how I got involved in it, and I realized that perhaps some of the fatty tissues may be extruding the toxic chemicals at the time that they lose the weight on a caloric-restricted diet. So I published a paper in 2012 in which we looked at toxic chemicals in the visceral fat in 3 different compartments: the retroperitoneum, the pelvic area, and the visceral omental area. And we found that, to our surprise, that a substance like DDE, which is a metabolite of DDT, and these are ordinary people, was about 1,000 times higher than the blood serum levels. And this is consistently so. And also, we also noticed that for the average person now, they are doomed to having lots of chemicals inside their bodies from, 500 times up. So then we said, well, what do we have to do to get this out? One of the things that Dr. Root had a lot of experience with was looking at the Agent Orange and the Vietnam War veterans, and he used a system that's not new, but he used niacin as a way to mobilize fat and also to free up the toxic chemicals locked up in lipophilic tissues, and that's fat and brain. A lot of substances come out from your bodies. But the two biggest surface areas are the skin and the GI tract. So in our clinic, we started thinking, well, we have to mobilize it not only from the skin by sweating after we use the niacin, but also using the GI tract to pull it out. Mobilization of the toxic chemicals, and then having a way to eliminate it and to excrete it out. Detoxification, by medical terms, is only in the liver. And that's very important, too. But to mobilize things quickly, you have to use this kind of system. By the way, if you lose weight, the Biosphere 2 study showed that if you lose weight, you will gradually move the toxic chemicals out from the fat to the blood, and then you can remove it. We know that if you use niacin, vitamin D3, you can mobilize the toxic chemical and the triglycerides. And at that time, you need to exercise to create a fast circulation, vasodilation, and then you're close to the surface of the skin and the GI tract, and then you have to pull it out, either by sweating or using substances like activated charcoal, zeolite, even oils will do that. Fiber will do that. So the best example is the 9/11 firefighters. There was a man who developed a Parkinson-like tremor along with, the cognitive problems. And what happened was they gave him the program, meaning they went into a very high dose. And after the program, he noticed that the towel was full of this purplish material. And the purplish material was manganese. And thereby, he was able to relieve himself of these tremors. And it's well known that overdose of manganese will cause this kind of symptom. That's a very, very clear example of eliminating something that was housed probably in his fat cells. When you lose weight, when you sleep, you are causing a lipolysis. When you cause lipolysis, you are freeing the triglycerides, but also you are freeing some of the chemicals. At that time, the blood level is high with the toxic chemicals, probably. Now, that's why yo-yo diets are bad, because if you don't get rid of it at that time by sweating, by mobilizing the GI tract, it goes right back into your fat cells. So yes, it is good to be lean body and to lose fat, but then you have to go into a sauna. You have to take niacin, and the niacin doses that we use for ordinary people is nothing like the 5,000 milligrams of niacin used for people who are highly exposed. The doses you can start with is about 100. You will get a flush. Don't get me wrong. This is a prostaglandin-induced effect. But as you get used to it and you do exercise and you take cold showers and you take post-exercise a sauna, any kind of sauna will do. It doesn't have to be any specific one. I've even used bath water. And this goes for any kind of substance, from anesthetics to medicines to toxic chemicals.
So maybe you can just touch on the protocol that you use for building a person up to niacin, because as you mentioned, it causes this flush, which can be very discomforting to anyone who's not had that before, and you have to gradually build up the dose to therapeutic levels of the 5,000 milligrams that you mentioned, which virtually no one would ever want to take that as a first dose.
For the average person, I would recommend starting with something like 50 milligrams trying it out, see how it feels. I tell people to take showers if they need to, and just be expectant that it's going to cause a vasodilation. Vasodilation, I believe, is important because it makes the arterioles expand, and it's close to the skin, therefore facilitating the elimination.
And
as you go from 50 on, you go up to something like 500 or even to 1,000, and you become accustomed to it.
And how long does that flush last for?
About 30 minutes.
What is the specifics of the protocol? I mean, how often are you doing the sauna niacin combination? Is it a few times a week? Is it every day?
For the average person, I would say twice is enough.
Twice a week.
Yeah. Mm-hmm. And, you have to mix in the exercise, because the exercise also causes vasodilation, increased cardiac output. So you're moving things. So we insist that, we follow the same protocol for the more toxic people, in that they take it, they exercise, and then they go into the hot room to sweat it out.
Obviously, it's very important tool to use in eliminating the toxins that we're almost all invariably exposed to. And I'm wondering if you can comment on some of the more common ones that you see that the typical person might encounter that this process would be useful for.
Well, DDT has been around, and many of the generations of people listening to this probably never even was exposed to it in an active way. Yet, it's in all over the whole world. And as I said to you, when I did that publication, which I'll send to you, we saw it up to 1,000 times higher than the serum. So it's already in the soil. And, of course, if you eat seafood, you're going to get a lot more. It's just naturally inherent by you existing that you're going to be exposed. What you have to do is you have to use an active, proactive approach like the programs to clean your body up.
Our strategy for keeping people healthy is to optimize your lifestyle by eating the healthiest foods you can, exercising, and getting sleep, sunlight exposure, good water, and the other key is to limiting your exposure to these toxic influences. But a sort of a subset of that would be to engage in a regular detoxification process to sort of.
I think it's even more important to regularly, proactively implement something to remove it out, because you don't even know what you're getting exposed to.
So what would you recommend for someone who's reasonably healthy as a frequency of doing this detox program? Because it sounds like it's a 30-day process, a few times a week, so that would take about a month. And so how many times a year should they do that? Twice a year, 3 times?
The way I look at it, I don't look at it as a 30-day program. It should be a part of your lifestyle. You should have a sauna at home. You should be doing this maybe twice a week as part of your exercise routine. I talk about exercise routine as part of moving your lymphatics and removing toxic chemicals out of your body.
Interesting.
So it's a lifestyle issue. Most people undergo yo-yo diets. And when we have people losing weight, we insist that they use the niacin to eliminate the toxic exposures in their bloodstream. We want to get it out. So every weight loss program should be thinking about that, but most of them don't think about that.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.